Hi everyone, I'm Robert and I'm doing my presentation on gingivitis. Most people think when their gums bleed when they brush and floss that it's a normal occurrence to happen, when in fact it is abnormal. What is gingivitis? Gingivitis is when the gums or gingiva is inflamed. It usually occurs when a film of plaque or bacteria accumulates on the teeth. Gingivitis is a non-destructive type of periodontitis disease. However, if it is left untreated, it can lead to more serious issues. Down here we have a picture of healthy gingiva, healthy gums, and beside that is diseased gingiva, aka gingivitis. Gingivitis can be localized, where it's just in a small area of your mouth, or it can be generalized when it's all over your gingiva everywhere. What are the main causes of gingivitis? The main causes of gingivitis is poor or improper oral hygiene, such as not flossing or improper brushing. This leads to gingivitis because when plaque does not get removed from the tooth surface, it solidifies and turns into tartar, or calculus. Calculus cannot be removed by a manual toothbrush. As it sits on your teeth, it becomes a nidus for bacteria. That bacteria sits there and it will irritate the gingiva, causing irritation. In turn, the gums become swollen and tend to bleed. If left untreated, this can lead to tooth decay and severe periodontitis. Other risk factors include smoking or chewing tobacco, older age, dry mouth, aka xerostomia, poor nutrition, such as having a diet high in sugar. Sugar causes a more, dangerous plaque, as it is stickier and will grab a hold onto your teeth in a more firm way, so it's harder to remove. Dental restorations that don't fit properly, such as veneers, crowns, and bridges. Crooked teeth that are difficult to clean. Certain prescription medications and hormonal changes. Okay, signs of gingivitis are swollen and puffy gums. Gums should be firm, they should not be spongy. Dark red gums are also a sign of gingivitis. Gums should be a shiny coral color. Gums that bleed easily when you brush or floss. This is the main sign of gingivitis. It is not normal for your gums to bleed and they should not be bleeding. Bad breath is a sign of gingivitis, although bad breath can be caused by many different things, such as dry mouth, just obviously eating something. But bad breath is a sign because when you have a lot of plaque, it's a nidus for bacteria, and that bacteria will smell. Receding gums, which we will get into because it's a big issue, and tender gums. Complications. Left untreated, gingivitis can lead to periodontitis. This is an advanced gum infection and destroys the soft bone tissue and bone that supports your teeth. Along with the pain resulting from periodontitis, teeth will begin to shift and eventually fall out, and it cannot be reversed. So when you have receding gums from gingivitis, it's periodontal ligaments that are becoming detached from the tooth, as well as the bone that holds your teeth in place is also deteriorating, and that cannot be reversed, so it's a big issue. Other diseases. Research suggests that bacteria responsible for periodontitis can enter your bloodstream through your gum tissue, and this can lead to some cancers, cardiac disease, respiratory disease, and Alzheimer's disease. Your mouth is pretty much the main opening to your body, so any sort of disease in your gums will go through your entire bloodstream. So how can we prevent this from happening? Sorry guys. The best way to prevent gingivitis is to practice proper oral care. Floss at least once a day and brush twice. This helps to remove plaque from your tooth surface, not giving it enough time to calcify. The way plaque works is that within 24 hours you should be disrupting the biofilm on your teeth, and within the 48-hour period, it will calcify. So this is why we say to brush twice a day. So if you do miss an area, hopefully on the second time you brush, you will disrupt that biofilm. And then when you floss once a day, it's important to hug the floss around your teeth to really remove any plaque. If possible, brush after every meal because this is recommended. Another great way to prevent gingivitis is to go to regular dental cleanings. It is recommended to go every 6 months. If you're at a higher risk of gingivitis, you should go every 3. 6 to 9 would be the main recommendation if your insurance allows it. Cleanings are great because a dental hygienist can help remove any calcified plaque and tartar that you have left behind. At these dental appointments, they will also do annual radiographs to monitor any changes in the level of your gums. Last but not least, it is important to have good general health to avoid getting gingivitis. Avoiding sugars and eating quality food is very important to the health of your teeth and gums. Eating anything like sugars and lots of carbs causes a different type of plaque in your mouth, like I said, and it's just more sticky and harder to remove. So eating healthy foods is really important. Also eating a lot of more firm foods that will remove the biofilm in your mouth, such as carrots, apples, anything that's sort of hard and crunchy. Conclusion. The goal of this presentation is to help implement oral healthcare in a proper way. The health of your gums is so important. If you do not take care of your gums, it can lead to bleeding and swelling and even tooth loss. And like we said, if it goes untreated for a long time, it can lead to serious disease and even cancer. Only floss the teeth that you want to keep. And those are just my references, the Darby and Walsh book, and then like a dental clinical practice book for dental hygienists. And that is the end of my presentation. I hope you all learned something exciting. Thank you.